Hey everybody, welcome back to the Align Chiropractic YouTube channel. I'm Dr. Mike. Let's get into another video. Today we're going to be talking about, are chiropractors real doctors? You may have heard of this before. It is a common misconception. So in chiropractic, we actually go through a very similar graduate program curriculum as a traditional medical doctor, but with a different clinical focus. So we do all of the same anatomy, physiology, biology. We do a lot of the similar coursework, but our board exams are going to be a little bit differently designed. As a chiropractor, I have no ability to prescribe any sort of medications. So my knowledge in pharmaceuticals is significantly less than a traditional medical doctor. But the difference between chiropractors and medical doctors is we're much more hands-on. So we're going to have a little bit more hands-on physical training with the body itself. So I'm focused more on face-to-face interaction rather than, pharmaceuticals and medical charts and things of that nature. So why do people think that chiropractors aren't doctors? Well, we can actually go back to some history in the 1980s where the American Medical Association actually lost an antitrust lawsuit against the entire chiropractic profession, trying to eliminate the entire profession. That's where you may have heard of the term quack. Chiropractors are quacks. So you can actually look this up on YouTube or Google, I'm sure. It's a court case called Wilkes versus the AMA. So if you're interested in kind of the nitty-gritty details on that, go check that out. But as far as the general misconception, we are in fact doctors. I have a doctor title because we have to look at the broad scope of the entire human body. Now, typically you're thinking, well, chiropractors are just dealing with neck and low back pain and you're just cracking the spine and you're on to the next room, right? Well, oftentimes certain issues or conditions may actually be medically necessary, a hospital visit, so to speak, but people will show up first in my office. An example I'll give you is a rib subluxation. The ribs wrap around into the back of the spine and connect. Now, rib subluxations is basically where the rib pops out, the spine turns, and it presses on a nerve. This can be extremely, extremely painful. It can actually mimic a heart attack. So as a chiropractor, I need to be able to know whether this person is having a heart issue or a rib issue. Very, very big difference in treatment. If it's a heart issue, I'm sending them to the hospital, to the medical doctors immediately. If it's a rib issue, come on in. We'll get that solved really, really quickly. So you need to be able to clinically identify what the problem is so you can identify how to fix the problem. So in my opinion, if we can take a non-invasive approach and a holistic approach to dealing with any sort of pain or dysfunction in the body, why not? Right? If we can avoid using the pharmaceuticals and the pills and the drugs, which do often have negative side effects, why not? And that's really where my philosophy stands, is a more natural, holistic, non-invasive approach. If I'm doing a good job, people don't need surgeries and medications down the road. But that's not to say that that's a bad thing, right? There's a time and a place for any treatment, so chiropractors can work well with medical doctors. Like I said, it's all about time and place. Thanks for tuning in. We'll catch you on the next one.